COVID-19 and co-production in health and social care research, policy and practice. The event is hosted by the Centre for Public Engagement of Kingston University and St George's University of London. I'm Mary Chambers, the Director of the Centre for Public Engagement and the Chair of this afternoon's event. We at the Centre are delighted to be able to host the launch of the book, and I'm just going to use Chair's privileges, as they say, and share some of my initial thoughts and observations about the book. For me, it highlights that in the pandemic, the groups that are most severely affected by COVID-19 and who have much to share in terms of their lived experience don't always get the opportunity to do that. By and large, they are ignored. And that's a pity, because they have such a lot to offer and are able to shape a lot of what we as professionals do. There is much that the book can offer in terms of collaborative planning for the next emergency, and no doubt there are likely to be emergencies, and hopefully the learning from this text won't get lost, and that it becomes a live and meaningful document. The book looks at how and why more collaborative and inclusive approaches could help with the preparation and consequently improve the nature and quality of health and social care, practice and policy in research in this new normal. It is a practical book, and for me that's one of its major strengths. It will help those involved in health and social care research, practice and policy to better understand and appreciate the importance and necessity of co-production in all aspects of their work, and not only appreciate and understand, but actively strive to make it a meaningful reality. Another useful element of the book is that authors end each chapter with their priorities for what needs to be done to address the issues raised and better serve the groups and communities that are discussed in their respective chapters. I would like to congratulate the editorial team for bringing together 100 contributors from a diverse range of backgrounds, including marginalised and excluded groups, all with lived experience. So well done, team. It was quite an achievement. Thank you. So I would now like to introduce Dr. Josephine Ocloo of King's College, London. Josephine is an academic. She's a researcher. She's an individual with lived experience. She is also the ARC Applied Research Collaboration South London lead for inclusion and diversity. And Josephine is going to tell us a little bit more about the book and highlight some of its important elements. So Josephine, over to you.
Thanks very much, Mary, and how exciting to be here. I can't quite believe it. After all of the work done on the book, we finally made it to the launch. And I'd like to thank all of you, really, from the bottom of my heart, for taking the time. So many of you are just so passionate about co-production, and I'd like to thank you for taking the time to kind of tweet about the book and to come and be here with us at the launch today. So I'd like to introduce you to some of the key elements of the book, and to say something about us and why we came to be involved. Diverse team, but diversity is a big thing, and you can never capture everything. But we have experience as service users, activists, and we're academics and researchers, and we all have a strong commitment to co-production. Peter Beresford, who many of you will know, was approached by Policy Press to write a book for their rapid response series exploring co-production in relation to COVID-19. He subsequently approached others, those of us who got involved, to see if we would be interested in taking the idea forward as co-editors. I certainly had never been involved in trying to edit a book before, so it was quite daunting to be approached and to be asked to produce something at very short notice. But because of my commitment and because of the people that were approaching me, I very much wanted to engage with this process. Now, convention is normally that authorship reflects who has had the most influence on the work, or who has made the greatest contribution, or indeed who has the highest status in academia. We had quite a lot of discussions about how we reflected the contributions of the editors in the book. And I would suggest that this is an area in co-production moving forward that people think about a bit more. How does this work so that we are properly reflecting the contributions of a range of people when they get involved in writing? So due to the varied and significant contributions made by all of the editors in this book, and in the spirit of collaborative and equitable ways of working, a pragmatic compromise was made to write the names of the editors alphabetically by surname, A to Z for volume 1 and Z to A for volume 2. As Mary has just said, there were over 100 people who contributed to the books. And we did a number of things to try and kind of make this book work in different ways. We prioritised bringing together a diverse and broader range of contributions as we could. One, people with perspectives that have been excluded or marginalised during the pandemic. And those who could offer practical expertise about redistributing power in working with diverse groups. And that issue of redistributing power was something that was quite important for us as editors. We encouraged contributors to form collaborative writing teams with a range of expertise and experience, and the editors provided support and guidance to teams. We made some funding available. It was only a small amount, but it was important to try and reimburse people for their time in some way. And we wanted to do that to pay service users, patients, carers, public members for their contributions. We prioritised accessibility and diversity. So chapters are relatively short and they're written in a diversity of styles, but always in accessible language. And that was really important to us. We didn't want to tell people how they should write their contribution, but we wanted to support people to write it in the way that they wanted. And we wanted the book to be as practical as possible, and we asked authors to end each chapter with priorities for action. So the books were written very quickly over a 6-month period, which included Christmas, and I can tell you that was quite daunting for some of us. And of course, for many of us editors, we were actually writing and doing all of this stuff in our own time. It was a challenge to meet these deadlines. I'd never been involved in editing a book, never mind doing so in such a short period of time and bringing so many people together. But, you know, it was really important for us to, you know, to try and provide enough support for different writers and their groups, whilst for many of us editors, we were also writing our own chapters as well. We realised that we would not be able to capture the experiences of all groups that needed and deserved to be heard. And ultimately, we had to do a trade-off with trying to spend more time to identify more people and with getting the book published at the height of the pandemic. What were the key drivers? The COVID-19 pandemic, as we know, and we particularly know this in this room, has drastically altered people's lives. And we've seen this reported extensively, and it has been the striking inequities and inequalities of impact and death, particularly of some groups, that has been most striking. Black, Asian and minoritised ethnic groups, people on low incomes, people in undervalued employment, people living in deprived areas, poor housing and or overcrowded or residential accommodation, older people, disabled people, people with learning difficulties, people with psychosocial disabilities and people with long-term conditions, especially those who rely on social care. So many people who have already faced disadvantages in society. And so this has been particularly devastating because, you know, these groups were already disadvantaged by structural inequalities before the pandemic began. And now, of course, new evidence is beginning to emerge, which shows that the coronavirus has disrupted routine healthcare disproportionately across society. And so new evidence is beginning to emerge that women, older people, and minority ethnic groups are most likely to report cancelled or delayed appointments, prescriptions, and procedures. A new study that was reported in The Guardian recently trawled through a whole range of studies which surveyed the population before and during the epidemic, and they found found evidence for widespread inequalities, with disadvantaged groups often facing the greatest disruption to their medical care. And so whilst experiencing healthcare disruption is common across all social groups, the study raised the possibility that the health of the most disadvantaged in society might actually be more impacted by the disruption to the healthcare system. So we therefore, as editors, came together to edit these books as a way to give voice to individuals, groups and communities with so much to share from their lived experiences, but who seem to have been largely ignored both in preparing for the pandemic and in developing responses to it. We know that innovative, participatory and co-produced approaches to research, policy development and service design can ensure experiential knowledge makes an important and unique contribution to tackling inequalities and inequities in society. But we also know that whilst innovative approaches are happening in many parts of the voluntary and community sector, and you're going to hear more about that shortly, there is still a very long way to go to ensure mainstream health and social care and research organisations are co-producing exclusively with diverse groups. The book therefore offers ways for developing inclusive, co-produced approaches to respond to health emergencies at a time of major change, where the search for new and innovative solutions is especially critical. This is a practical book, something to help those involved in health and social care research, policy and practice to appreciate why co-production is worth doing and to learn about different ways it is being and can be done. To achieve these aims, the book is divided into 3 sections. 1, the impact of existing structures. 2, the pandemic and increasing marginalisation. And 3, working together at a distance, guidance and examples. Each section is comprised of a series of chapters from contributors with relevant expertise and experience. Sections 1 and 2 are collected in Volume 1, the challenges and necessity of co-production. Section 3 makes up Volume 2, co-production methods and working together at a distance. The grave consequences of following the precedents set during this pandemic emphasise the urgency with which we must act to do things differently. This book demonstrates why co-produced responses are required, Volume 1, and how policymakers, practitioners, service users, activists, patients, public and communities can make this happen both now and in the future, Volume 2. So whilst the speakers today represent only a tiny number of the contributions in the book, we are absolutely delighted to welcome these speakers and to hear their stories of co-production in practice during the pandemic and moving forward into the future. So I'd like to hand over to Mary to introduce the speakers that I've set out here on this slide. Thank you.
Thank you very much, Josephine. That was a really lovely introduction and background to the book. The next person I would like to introduce is Ellen is a disabled activist and author of The War on Disabled People, Capitalism, Welfare and the Making of a Human Catastrophe.
I'm Ellen Clifford. I'm a disabled activist, a mental health service user, and author of The War on Disabled People, Capitalism, Welfare and the Making of a Human Catastrophe, that was published last year by Z Books.
And I'm Mark Dunk. I'm a disabled activist, trade unionist and print worker, and I've co-authored a number of articles alongside Ellen. We're now going to give an overview of our chapter, Disabled People's Deaths Don't Count, how a protected characteristic offered disabled people little protection during the pandemic.
So I'm sure you're all familiar with this statistic, that between March and November 2020, According to the Office for National Statistics, 6 out of 10 COVID-related deaths were disabled people. And it's important to remember that this is just the lowest estimate of how many of those deaths were of disabled people. And I think it's true to say that disabled people have been quite disappointed, even distressed, at the lack of public outcry there's been over the disproportionate scale of deaths from our community. For some groups of disabled people, the mortality rates have been even higher. For example, disabled women. And then for younger people with learning difficulties, they've been found to have been up to 30 times more likely to die of COVID than non-disabled peers of the same age. Our chapter focuses specifically on the situation in England during the pandemic, not because we're England-centric, but because we're very aware of differences between the devolved administrations and how the pandemic has been handled. Globally, however, there are common themes in the way disabled people have been treated during the pandemic, and these themes are common regardless of the levels of development of respective countries. These themes are disabled people, most at risk, but viewed as less important to keep alive. In England, treatment rationing guidelines were used to prioritise life-saving treatment for non-disabled people while restricting disabled people's access to hospitals. Disabled people overlooked in policy responses. For example, decisions to ban visitors from hospitals didn't take account of disabled people needing support to understand and to communicate, leaving many to die frightened and alone. Disabled people subject to violations of our right to life. In England, this took the form of unlawful use of do not attempt cardiopulmonary resuscitation orders on people's medical records. Disabled people subject to comments and debates regarding our dispensability in the interests of the economy and of our lesser value to society than non-disabled people's lives. Disabled people subject to narratives on disproportionate mortality rates that have essentially blamed disabled people while avoiding the role of socioeconomic factors, bad political decisions, and discrimination in the high death rates. So, for example, Public Health England explained the high mortality rates of people with learning difficulties as to do with prevalence levels of comorbidities such as obesity and diabetes, and failings by people with learning difficulties to understand social distancing information. In fact, an analysis by the Office for National Statistics that took account of age and health-related factors found that disabled people were still dying disproportionately. Disabled campaigners and public lawyers have used the law throughout the pandemic to challenge discrimination, but being a protected characteristic has been of limited help. If exclusion, lesser life chances, and higher mortality rates are still widely considered within society to be inevitable for disabled people, this is even more so the case for disabled older people. The government's also been careful to legislate for easements of public sector duties in key areas such as social care and educational support.
So I'm going to look at the recommendations that we finished the chapter with. We started by noting that the OECD, World Health Organization, and the Swedish Corona Commission have called on governments to use the tragedy of care home deaths to incentivise the introduction of measures to address pre-existing structural issues with the social care sector. And while we agree there are deep structural problems with the social care sector, simply calling on the governments that have really neglected their duties around social care, to put it mildly, during the coronavirus pandemic isn't going to be a successful way forward. So some of the recommendations we've come up with are to explore and unravel the overlaps between old age, impairment and illness, to better challenge narratives concerning vulnerability. So this introduction to the vulnerability narrative really sort of locates the responsibility for those deaths in the individual disabled people rather than in government and institutions where we think the blame properly belongs and where the change has got to be made. The second point we had was to build support for a national independent living support service, an existing demand, which is for a service with paid for from general taxation, free at the point of delivery, essentially to have a workforce that can provide support to live independently for disabled people with various impairments, with them getting proper training, pay, etc. I think that the situation of the pandemic's highlighted why we need this. So that's just something that we want to reaffirm. And then we want concerted campaigning to prevent further privatisation of the NHS, the sort of fragmentation there, and lead to problems for disabled people with the responsibility for meeting disabled people's needs unclear between all the various different organisations, and leads to real problems. We need a sort of NHS that's delivered the vaccination programmes so successfully. We need that sort of linked up ability of the NHS to provide for the needs of disabled people. And the last point is that we want disabled people's organisations and practitioners in the UK to build stronger alliances with disabled people, both nationally and internationally, to share their experiences in solidarity, to reflect the grassroots experience of disabled people throughout the pandemic in the response to it going forward.
Yes, that was really quite powerful presentation and extremely disturbing, really, when you hear it from people who are directly involved with that, about the discrimination. So thanks to both of them. Our next speakers is Lucy Allwright and Niam Iqbal. Lucy is an experienced researcher, project manager and trainer with specialisms in multiple disadvantage, trauma-informed practice, and expert by experience participation. She is committed to creating space and platforms for women to have a voice in creating change. She holds a PhD from the University of Warwick and is one of the co-founders of activist group Sisters on Cups. Now, Emma is a professional lived experience researcher who has worked for a number of organisations, including Against Violence and Abuse, McPin, Agenda and Manchester Metropolitan University. Her research specialisms include multiple disadvantage, trauma and peer support. She is also a qualified gardener, experienced crafter, using these skills to support her community. So over to the two of you. Thank you.
Hi, thank you, and thank you for inviting us to speak today. And the chapter that we were asked to contribute to was around a women's peer support project that we've been running in one London borough. But at AVA we do a range of participatory and involvement projects. We've been working with experts by experience to set up a domestic violence support app. We've been involved in a lot of peer research around gender-based violence and the intersection between domestic and sexual violence, substance use, mental health. We're currently also doing some peer research around women who've had children removed in the context of domestic abuse. So lots of work, and really it's always an evolving thing at AVA in terms of learning how to do this, because we don't always get it right. So I think, you know, one of my first recommendations is that you have to be brave and accept that you're not going to get co-production right. And it has to be a collaborative approach. So this chapter looked at our Women's Voices project, which was a homelessness project in a London borough to set up peer support groups for women who were experiencing domestic and sexual violence and homelessness. Unfortunately, we'd just begun when the pandemic hit, and there was a big focus on moving homeless people into accommodation, and so we paused the project. And what we decided to do was some peer research over the summer of the first lockdown to try and find out what was happening to women, and that became the basis of this chapter as the kind of means to look at what we were doing. Naima was one of the women that interviewed women who in the London borough, and she's going to give a bit of a summary about the chapter content and kind of what we found about women's experiences of both the pandemic, domestic and sexual violence and homelessness at this time. So I'm going to hand over to you, Naima, to just talk about the chapter content.
From the ladies that we interviewed, myself and Sonia, I think it was unanimous that everyone was feeling that it was like a re-traumatizing situation. The experience of lockdown actually mirrored the abuse they'd suffered previously, and whereas they were in recovery, they started basically going downhill. There's a lot of loss of support network, communication with other people outside of where they're staying, increased waiting times, and they felt trapped in their home with no access to therapy. They couldn't go out, you know, all of that thing about ordering your food online, etc. And then obviously for people that were refugees and asylum seekers that were actually homeless and in temporary accommodation, for them it was double triggering, because not only did they have a language barrier, but they had no access to support workers. One lady was actually in hospital with COVID as well, which must have been terrifying because she was literally on her own. and that she almost died, basically. It was that bad. And she had children. The experience of lockdown triggered trauma, like I've just mentioned. Myself, I have PTSD. It was made worse. I'd had housing repairs for 2 years. That was left. That's my own personal experience. And I can imagine when I was talking to these ladies as well, a lot of them didn't know where their next meal was coming from, even accessing support workers for food parcels, not having enough money, feeling that they were inadequate in one case because the lady needed halal food because she was from a Muslim background, and not knowing the language, she felt like she was doing something wrong by asking, and then obviously there was no one to actually ask for the help. Experience of lockdown left people without support. Again, loss of face-to-face, your whole routine, when all your coping mechanisms gone, because a lot of people were using mindfulness. They were all already isolated from their communities and in recovery from trauma, and this is actually, it's delayed their mental health support or the therapy, and basically they had no network with anyone outside. For myself and Sonia, the way we felt was that it offered us something to focus our attentions on and actually turn this situation into something positive, where we could work from home. We got to, not face to face, but speak to other ladies that were going through it and are going through it right now and at the beginning of their journey, and actually connect with them on the phone. And I think it was a good feeling for them as well. We felt like we'd been trusted with something, you know, of value, because we wanted to contribute to this research. And also we were paid an equal wage to people that are actually working for ABA as well, which was amazing, obviously, to actually feel valued and actually feel like you're a working member of society just like everyone else. And of course we use trauma-informed approaches. So I went with how people felt. If they didn't want to be interviewed, they could reschedule. If it just wasn't the right time for them, we got interpreters in place as well where we needed to. And one lady, she didn't want to speak. She was too traumatized. So that was really difficult. It offered us hope and a space for progression in terms of our career as lived experience researchers. And it also made us feel empowered that we were able to reach out and connect with marginalized women that were going through what we've been through, and to actually help them feel empowered that, look, you can do what we're doing now. So I think our summary was, if you give people the opportunity, it makes them feel like they belong and that they're worth it.
Just going to briefly go over the recommendations that we made kind of based on this, and it was particular about how organisations can kind of do this and ensure that they're working with women who faced violence and abuse. We talk about taking a gender and trauma-informed approach, which I think is really bandied around a lot, and it's a huge piece of work to do that. By gender, we understand that there's intersections and that, you know, there's that gender is impacted by the other things we're talking about today, by ethnicity, by disability, by your asylum status. So I think it's really important to understand that gender isn't just one thing. And by trauma, we mean in particular that for many women who are interacting with services, they will have faced forms of violence and abuse, and that the service model can often mirror those forms of abuse because they feel done to rather than done with. And I think that when Naima spoke about feeling like she was on more of an equal footing, I think that has to really be the core of what you try and do when you're co-producing. It has to be about trying to do this together rather than doing to someone. As a result of that, the work that we do is around, we try and provide fair payment, and I was really pleased that people paid to contribute to this book. I think that's quite rare sometimes, so thank you so much. We talk about transactional relationships and abuse. Women constantly talk about feeling like they have to give something if something is given to them. So we wanted to try and move away from that and value people's work. Flexibility and choice has to be at the core of co-production, and it's about giving people control. Again, if you've been done to, then having an opportunity to say no, to understand what the boundaries are and the rules are really, really important. We also worked around digital accessibility. So moving on with the peer work that we did on this project, we looked at providing people with technology. We looked at whether we could allow people to access the project in different ways. Trusting relationships are crucial, and a really important part, I think, of co-production is building building personal relationships with people. So it's about getting on the phone and talking about nonsense, not just talking about projects, understanding where people are in their lives and also giving something of yourself. Trust has to be at the core of that. And if we have a model where we don't offer our own selves, then we're not going to get anywhere. And I think it was really important to combat isolation. Prioritising physical and emotional safety of participants is really important. And understanding triggers, working to create boundaries is really, really crucial. Having check-ins, reflective practice. We also, for this work, recruited 2 clinical supervisors who've gone on with our peer support groups and those running peer groups to provide clinical supervision. One of our peer support groups that came out of this was Turkish speaking, so we made sure we recruited a Turkish speaking specialist who had a background who sought asylum herself, so she had the same experience as the women. And I think the most important thing is creating opportunities for empowerment and healing, as I'm doing now. Co-production must focus on empowerment and provide opportunities for growth. And really, I think one of the things about violence and abuse is it takes away power. And for me, co-production is a form of activism that's about collectively building power. And I think we should use the word activism in all our work to say that, you know, we need to change society by working together and listening to voices and trying to access those voices that we don't always hear, because those are the ones that can help us to improve how society treats everyone. As Sonia said, one of our researchers, fighting together to survive is a good thing. And we've gone massively over, so I'm sorry, but I'll just leave you with a final slide from a woman from one of our peer groups who contributed, who just said, don't succumb to injustices. And she talked about when women talk, we change the world. And I just thought that was a really beautiful statement. So a lot of nurturing is expected from women. So I think that our voices matter, and it's really vital to listen to women and their experiences. So thank you.
That was another really powerful, emotional presentation, and it brings a whole new meaning to stay home, stay safe, because it's far from safe, particularly if you're in an abusive relationship. So thanks for sharing that, and I do hope that people will pick up on some of the key points that you've raised in your presentation, because it really struck me. Thank you. Shall we move on to our next speakers, and that's Mike Hudson and Andy Guys, and they're going to talk about going remote, using technology to co-produce homeless health research. So before we hear from Mike and Andy, I would just like to give a little background to what they do. So Mike Hudson, or Spike, is co-researcher on the homeless health peer advocacy evaluation. He has lived experience of homelessness and social exclusion. As a trained homelessness peer researcher, he has worked as a market researcher for Ipsos Mori and field interviewer for the Office of National Statistics. Spike is trustee of a homelessness charity in Southwest England. Andy Guys is a lecturer in social science at King's College London. His research focuses on health inequalities and experiences of urban exclusion in the UK and globally. Current studies he is involved in are focused on health services and public health strategies in support of people who are homeless and use drugs. So with others, they co-authored a chapter for this edition, for this edited collection titled Going Remote, Using Technology to Co-produce Homelessness Health Research. So over to you both. Thank you.
Thanks, Mary. We're both going to be talking about our work exploring experiences of co-producing research on health amongst people who are homeless, which predates COVID, but we're going to especially talk about what we did during COVID-19. So COVID-19 obviously had massive impacts on many people who are homeless over the past year or more, many of them horrendous, but our focus today isn't on that. We're very much focused on the mechanics of how we did our research. But the focus today is on talking about the mechanics of what we actually did, and in particular, like many sections of UK society and globally, grappling with the challenges of remote work and remote research. So yeah, Spike couldn't be here today, but he really got into the spirit of our work, giving a remote contribution to a remote presentation about remote work.
Hi, my name is Michael Hudson, got a street name of Spike. I've been homeless and I've been trained in research techniques. Our chapter is based on our experience in a co-produced research project evaluating a homeless health peer advocacy project run by a charity called Groundswell. Partners in the research are the London School of Hygiene and Tropical Medicine, King's College London, University College London, and several freelance interviewers like myself. At the beginning of 2020, when the COVID lockdowns started, we were no longer able to go into the hostels and day centres and speak to folk face to face as we had been doing. So we had to move to remote working, e.g. telephone interviews and online.
So as Spike said, we've got a wide team, and that's bringing together experience from 3 studies in particular. So the study Spike mainly worked on, that's with Spike, S.E. Maniyanka, and then myself and PJ from King's College London, as well as Lucy Platt, Sujit Rathod, and Perniz Hussain from the London School of Hygiene and Tropical Medicine. And we were all working together on an evaluation of a peer advocacy service for people who are homeless, and that's run by Groundswell. In London, it's a service that works across the UK, but the evaluation is in London. That predated COVID, but the evaluation is also ongoing now. So overlapping with that team, we had another smaller study going on that particularly looked at experiences of COVID-19, and that also involved Stan Burridge from Expert Focus. So Stan is an expert by experience, and he heads a research organisation that focuses on that kind of work. And then also we had Martin Burrows from Groundswell, and Martin and peer researchers from Groundswell have been working on a study monitoring experiences of people who are homeless during COVID-19, but across the UK. And they drew on a particular technology that was first used during the Ebola epidemic in West Africa a few years ago. So the chapter is focusing on experiences across those 3 studies. As is clear, COVID-19 radically changed how many of us have been working for the past year. And the chapter has a few points on how that went. And there's just 2 that we're going to focus on. I'm going to just talk about one now and then Spike in a second. The first one I want to talk about is what social scientists call reflexivity, but a more general term for it might just be being thoughtful and careful and sensitive in how we approach our work and how we work with other people. So the ongoing careful reflection on what we're doing and how our own experiences, beliefs and judgments are shaping what we do. So that's a core process. It should be a core process in any research, but especially co-produced research. And what we found in having to reorganize everything and to do this repeatedly, it prompted us to constantly think anew and to make more time over it. So actually COVID-19 was, in a very unwanted and perverse way, a benefit. It forced us to spend more time actually thinking about the minutiae of what we're doing. So before COVID, you know, in the hurly-burly of applied research, as our team, we might have been satisfied with getting together for one afternoon for a training session. But given the new challenges, we sort of actually thought we need to spread this out. And so, you know, the basic technology of phone calls was used, and we spread this out over many weeks rather than one afternoon, giving a lot more time and opportunity for, you know, for us as a team to get to know each other and to think together about what we were doing. So there's a pressure there. Well, it was a pressure to do it because we felt we had to, but also in some ways the pandemic brought the opportunity to do it. Some of us felt we had more time. You know, it was easier to get people together in some respects. I'm going to hand over to Spike now for the second and hope. Yeah.
So reflecting upon our experience so far of delivering a co-produced research project with homeless folk during COVID times, we would say we like co-production, we like reflective practice, we missed visiting schemes, and we missed out on being able to create the best space conducive for interviewing. In one interview, I could hear voices in the background over the telephone, and it turns out it was the participant's key worker telling him off for not tidying his room while I'm asking him delicate questions in confidence. The participant didn't seem too bothered, but I'm yelling down the phone, "Bugger off, lady, he's in a meeting." Thank you.
Spike responding to my challenge to get a swear word in as many presentations as he can. Yes, that's kind of a challenge we had to think about, was actually, you know, we're doing this remote work, we're using technology that is in some ways quite straightforward, the phone, but it also removes you from the context in which you're collecting data, which brings a lot of challenges. So I'm just going to finish on what needs to be done. So Spike into that, using technology as a challenge. So in this world, you know, we need more than the line item of a laptop or a phone in a research bid. We also need to, you know, there's the other details of internet access, encryption technologies, phone lines, and how all that might work. And those need to be considered and costed, but that also needs to be in the context of finding creative solutions. So how do you manage GDPR when encryption might not be possible? So again, it's working creatively with the technology we have. Secondly, and what we considered on balance of benefit, even if sort of unwanted and perhaps forced on us, the wholesale change to practice has fostered reflexivity, or at least it did for us. You know, it was a welcome reminder to prioritize it. And finally, and overarching with remote research, you know, likely to persist in the short term at least, and likely longer, we need to really try and tackle head on the digital divide that limits the engagement of people who are currently homeless and people with experience of homelessness as well. So those are political, institutional, financial, and training issues, but also, despite the issues involved, they can be addressed. Just our last slide, where, yeah, thank you to everybody who's involved in the chapter and everybody involved in the research, and especially who funded the research.
Thank you, Andy and Spike. That's very insightful presentation. Also raises issues about people who are in less privileged positions than some of us, and who don't have access to technology. Whilst technology is really useful and important, it also brings with it its challenges. So thank you for that. Natalie Carey is the Director of Black Tribe, Lambeth and Public Health Lecturer at Middlesex University. Black Tribe focuses on addressing inequalities across the social determinants of health and co-creating better futures with Black communities. Her research explores how privilege and systems of oppression shape health and well-being outcomes. Natalie co-authored a chapter for this edited collection titled "Are We There Yet? Co-production and Black Tribes' Journey Towards Race Equality in Mental Health." So Natalie, we look forward to hearing your presentation. Thank you.
As Mary mentioned, I'm from Black Thrive. Our mission is to change the odds that are stacked against Black people by embedding race equity in systems change, so that thriving becomes the norm rather than the exception. And placing the voices of communities at the centre of what we do is a critical element of our work. And co-production is an approach that we use to assist us with this. And in some ways, it was our default position. But the invitation to contribute to this book series has encouraged us to think more critically about why we do this thing called co-production, what value it adds and for whom, why are we even in the space, and what value do we bring, but also, are there other alternatives? So this is the team who, my team who have been sort of participating in sort of like the chapter. And although we work in the same team, it highlighted differences in our perspectives about the necessity of co-production in our work, and offer differing perspectives. And that enabled us, I think, to produce a chapter that perhaps may be more balanced, because there is often a temptation to present the shiny side of co-production. And on the face of it, the concept makes us feel warm and fuzzy inside. And we see from our work that it can affect change. And we've seen this from the work on the employment project and the research that we've done. It has elevated the voices of Black communities, but has also been an important part of informing and influencing policy and practice. But the intention to give voice and to share power doesn't always materialise in reality, and in fact it can be extractive and exploitative, and I think that's what we were exploring in this chapter. And I think our reflections sort of reinforce that our Black and multiple identities do bring true value to the work, but also that Black people are often not given the space or the opportunity to really occupy these spaces. And we also reflected on our own experiences of being participants within co-production processes. And we found that what we observed is that we often saw the same power structures and systems of oppression operating within these settings. And that co-production isn't necessarily always a safe process. It can often reopen old wounds, and especially without providing adequate support for people who are telling their stories or sharing their ideas, or even when we need to start thinking about, well, what is the support for the people who may be holding these spaces? These are kind of really important reflections that we need to consider. We also felt that the sort of sticky plaster approach, co-production that makes us look busy, sometimes being favoured over an opportunity to use co-production to stimulate action around systemic change, and the reluctance of creating the links between inequalities and oppression. They're either ignored or they're silenced. And Black communities are seldom sort of hailed as the heroes of the co-production process. And the people who are often lauded are white people who facilitate the process. And so what we have is that the wealth and expertise that exists within the Black imagination are extracted without recognition or reward. So when we're thinking about what it is that we need to do to make co-production a more equitable process, it's really important for us to think about how we value the expertise within Black communities and how we resource them to lead the process, because essentially we can't do this work without them. We need to create space for reflexive practice, to be willing to interrogate whiteness and to challenge racism in the spaces that we occupy and share. We need to ensure that there is an equitable share of the benefits, and not the expectation that Black people should just be kind of happy and satisfied with the benefits that arise as a result of changes to the service that they receive. And it's really important that we situate the problem that the co-production process is trying to address within the broader structures in society. And that's, because I think that the statutory sector and the voluntary sector place a lot of energy on kind of individuals and communities. And that's not to say that community action isn't important, but actually we need to spend more time, I think, really focusing on upstream activity rather than downstream. And then I think we need to think more broadly about involvement, so that it's not just restricted to the co-production process, but that we're thinking about involvement and inclusion and kind of anti-racist practice within the context of our organisations and our broader practice. So ultimately, if we want to narrow the inequalities gap and to change the odds, we need to think more seriously about applying a race equity lens on the co-production process.
The next section that we have allotted time for is to have some questions. So if you have any questions for any of the presenters from today, or any of the editors who are also here on the call, please do type them in the chat, and then we'll get people to answer them for you.
Ollie, there's a question from Anne Galpin for Natalie, and she said, please, could you unpick upstreaming the process a bit? Okay,
so I guess when we're thinking about the inequalities that we experience, often it's about like so in the context of like black people and access to therapeutic services, it's like, how do we get Black people to like access them? So what we need to do is we need to make them more aware of the services that are available, but not necessarily thinking about, from a more structural perspective, what are the issues with why are their services not fit for purpose? The kind of paradigms and the mental models that they use to kind of shape their services, in particular around like using Eurocentric models, or not necessarily thinking about like representation in their teams, and how those factors may be shaping people's access to services.
I noticed in the chat that there is a question from Meerat Kaur. How do we address the digital divide?
I think that's a huge question that lots of people can answer from in this group. If we go to Andy, I think, because they're going remote, chapter directly touched on this. And then if anyone else wants to contribute after Andy, then please do jump in.
I'm sure there's lots of things to consider here. Just a couple of points. I suppose there's lots of things which are fairly obvious, as in just funding, getting phones, getting laptops, paying for internet access. But a parallel thing is to actually work out how people use technology in their lives. So I use my phone and my computer, my technology in my own particular way. The people I do my research with, people with experience of homelessness, perhaps experiences of drug use, are often using phones in their own particular way, in ways which work for them, and might have particular both opportunities and needs. So for example, if what you're doing is, some of what you do in your time is criminalized, you might have specific concerns about privacy. So putting some information online, which isn't going to work, whereas other people might be much more willing to share things online. So I suppose it's responding to the specific ways in which people are already using technology, which say authorities and institutions might not be aware of.
Thank you, Andy. There is another question from Kay Oliveri for Natalie and Josephine. Do you feel that the level of Black Thrive research is the next shift on from Black Lives Matter that people are so desperately wanting to see? So Natalie and Josephine, over to you.
I'll let you go first, Josephine.
Shall I just convey again whilst I'm here?
Yes, please. Just
yeah, it's just, I'm just really desperate for people and organisations and networks and individuals to move on this Black Lives Matter rhetoric that's we're so desperately wanting to see. And what, Natalie, you've just presented seems to me as a real almost paradigm shift onto making that fundamental difference that we all want to see is at the level that we kind of need to reach to move this narrative on.
I remember when I read the chapter that Natalie led on with the rest of the team, and I was just like, this is just simply spot on. This is just what needs to be said, and it just needs to be said loud and clear. And I think that these are the sorts of messages that Black people in co-production circles and in working with health and social care and research have been making for such a long time that they're completely worn out with the process. And I just don't think that, you know, Black Lives Matter has just simply shone a spotlight on the sorts of issues that Black people were saying for a very long time. So I was really delighted that the Black Thrive team just said it so clearly. Read that chapter, and I really just hope that we need to do something different when it comes to addressing some of the race inequities, because the irony is that we created a movement in which Black people are still standing at the back of the bus. And I know other groups are also standing at the back of the bus. But sometimes when you just talk about race, you just got to say, why are Black people left standing at the back of the bus? And I'm somebody who's a harm patient activist. And I found myself in all white circles time and time again in spaces that are supposed to be co-producing.
I'd probably agree with Josephine in the sense that I think the Black Lives Matter movement has kind of created space and has kind of stimulated that conversation and in some respects have given people permission, I guess, to raise some of the issues that have been bubbling under the surface for a long time. I think that there is something about the importance of Black people being able to tell their own story and to have their own vision for their future that is not shaped or determined by people who don't share our lived experience. And I think that generally speaking, we don't have the opportunity to, to do that. And I think for us, pulling this sort of chapter together as a team, I think sort of highlighted a lot of that for us, that we perhaps have just been going along our merry way, kind of just doing the work, but not necessarily sort of like having the space to be able to kind of really think about it from that perspective. So I think that there is definitely, the gap, whether we're looking at the literature, whether it's kind of co-producing solutions, it's not that we don't have ideas, it's not that we don't have a wealth of skills and expertise to bring to this, because who knows our situation better than ourselves because we're living it. But the power structures that we exist in, favour those who don't share our identity, fundamentally. So if we look at who gets funded to do this work, Black-led organisations are chronically underfunded. That is a systemic issue. And then even when you are funded to do work, you often find that you are under higher levels of kind of surveillance because there isn't the trust that you'll be able to deliver the work. So these are the things that we need to kind of surface and be very open about if we're really going to sort of challenge that and to start to disrupt things, because it's only really by doing that are we really going to see change.
Great. Thank
Okay,
you.
Natalie. Thank you very much. There are a couple of other questions in the chat, and then I think we will have to call the questions to a halt because we are running short of time. Anna Galpin asked, Andy and Spike, what was the training in research techniques that Spike did? Is this available to other people with lived experience involved in co-production? And or do other contributors know if any training in research techniques for disabled people with lived experience exist?
I'll quickly respond, but sorry, I saw that chat function a little bit late. There's lots of resources out there, and I think a lot of the training Spike did, he did a long time ago with Groundswell. In terms of our particular project, it was less than a question of training because everybody was trained, everybody's done research before, and more as pooling our different experience. So, for example, the training, as we might call it, on doing interviews over the phone, Spike had already done that before, pre-COVID. So it was, the academic researchers who were being trained by the peer researchers in that situation. I think the only thing I would definitely say is perhaps any off-the-shelf training, make sure you tailor it to the particular people that want training, because there's a big risk that you end up plowing through the basics that everybody has done 7 times. I say that from my own experience as well.
Okay, and Yasmin had asked about stats.
I just wanted to know whether there are any stats available with regards to the inequality of race in research.
There are bits and pieces, but off head, I can't think of any. Do you, Josephine? There are some, I think, resources in the Wellcome Trust's anti-racism toolkit on research, but off head, I'd have to go back and have a rummage around, I'm afraid.
Thank you, Natalie. I'm afraid we're very quickly running out of time, so we have just got one final presentation, and that's from Meerat Kaur. Meerat is a contributor to the book, and maybe you'd like to say a bit more about yourself, Meerat, before you begin your presentation. And you wrap up the session quite nicely by asking what needs to be done now. So editors talk about overarching themes in the book and the next steps for addressing them. So are you going to collate that and pull that all together?
Very briefly, yes. I had lofty plans of co-producing this whole session, but yeah, that's not going to happen in 3 minutes or something. So basically, I am just going to be here just to conclude this what we've heard today. And I am from the NIHR Centre for Engagement and Dissemination. I am one of the co-editors of the book, and I drew the short straw in terms of trying to sum up those amazing presentations that we heard today. And so the presentations were a really useful example of, or examples of, people in community finding solutions and responding to challenges that COVID had exacerbated or highlighted or emphasised. These were often things that were already there and that we hadn't addressed as systems and as healthcare organisations. And I think that was really what was important to us as editors. We were committed to this book because we believed in it being an opportunity for people who had amazing examples of learning that could provide real tangible solutions of our next steps to tackle inequalities and to improve people's lives in a way that we haven't managed to do yet. We are in this unusual position where my daughter's going to have worse outcomes, or is expected to have worse outcomes than I am. And that is really unusual, but also it's quite frustrating that actually we aren't necessarily finding the solutions to tackle that. So these books really provided a response and solutions from people who are working on the ground and in these specific spaces. And for us as editors, it provided an opportunity to really kind of bring together academia and practitioners and provide spaces, hybrid spaces, which are more accessible, which helped people share their learning. And I'll be really brief, so I'm not going to say too much more, but one of the key things I think it's really important to acknowledge is the challenges to this. So we hear no end of motivation amongst community groups and individuals to find these solutions and work in these co-produced ways. But this isn't enabled all the time by the wider systems that we work in and by wider health and care organisations. And in terms of a commitment, that doesn't necessarily result in resources and support and the safe spaces that we've heard about that are so necessary for this way of working. And crucially, that means that we're not really scaling up what we're doing. We're still very much in smaller spaces or in specific geographies. So we really need, we are as individuals and communities are brave enough. We've seen that in the examples that are shared in these books, and what we heard today was only a small number of the examples in these books, and there is a lot of bravery in those books, but what we're not getting is the response from wider systems and organisations, and something does need to change in terms of how we go forward and how we position these as these solutions and responses. So one example of the movements that are created from these co-produced initiatives is something that the co-production collective have done. So they model a lot of co-production in their approaches in huge various ways. And one of the things that they've done today is a co-produced book review. So sorry, this is a bit of a tongue twister because it's a very new concept to me. But so this co-produced book review was with over 30 people from the community and from individuals that they work with. And basically these individuals reviewed each chapter of the book. And this is available, I think, Nicholas put the link in the chat for people who want to see it. So it's available as an example, a really good example of what can happen when we work in these collaborative ways and when we just kind of go off and continue to create increasingly more co-produced approaches. And it's really useful to see that, but we need to now create more spaces, more accessible spaces to share this learning, and in order for us to kind of really build on these solutions. And I will leave it at that.
Okay, thank you, Meerat. That's a lovely bit of summing up that you've done. We've now reached the end of our time together. I would just like to say a very personal thank you to everybody who has presented and all of the people who have joined in, contributed to the chat and so on. For me, it has been an absolute privilege to hear from you the stories and all the issues that you have raised, and I do hope that the books set the scene for more work and provide more clarity around some of the really important issues about co-production. So thank you ever so much, all of you, and I look forward to meeting you again in the future.